Right now, Canada is living through a healthcare crisis. No, not the COVID-19 crisis. The crisis that I'm going to talk about today is one that has been going on for much longer. It is a crisis that is at once hidden, dismissive, and divisive, the existing gender disparity in health leadership. If you're not immediately nodding your head in agreement, it might be because you haven't seen the numbers. Picture this. Imagine all the health estimates that 70% of those are women. In Canada, the number is closer to 80%. Okay, so what disparity am I talking about then? Well, let's take a look at the numbers again, but this time looking specifically at leadership positions. I'm talking deans of medicine, senior roles, members in the boards of directors of hospitals and other health institutions. So I'm really talking about people that have the power to make the decisions that shape our healthcare system. Here, only 25% are women. So where did all the women go? More than that, even in leadership, women continue to be paid less than men on average. One of the reasons? Lack of women in positions of leadership. So when I started studying health, I didn't know about any of this. I joined the field because I wanted to help people and optimize people's health. Physiology and other classes for over 6 years. I only recently became aware of women's health and realized that the field that I admired for providing people with care actually reinforced societal biases and gender disparities. This problem is hidden. Canada does not currently collect data about gender diversity in health leadership systematically. This means that Canadian statistics are limited because thinking of this as an issue to address. This problem is amplified when one looks through an intersectional lens at the representation of BIPOC women, women identifying as LGBTQ, women from low socioeconomic status backgrounds, disabled women. So, all of these populations are not being represented equitably in leadership and thus are not being considered or reflected when making decisions about policies that affect their own health. This gender disparity is dismissive. It ignores the efforts that women have made and continue to make to advance the field and to advance in the field. Hundreds of women have made incredibly valuable contributions to the health field, and yet these figures are not acknowledged, to the point that most people, even those of us studying within health, have difficulty naming even just 5 health leaders that have changed history. Or do any of these names ring a bell? All of them are recipients of Nobel Prizes in physiology and medicine within the last 75 years. This problem is likewise pervasive. It affects the areas of health and goes beyond profession, affecting research, policy making, health workers, and even patients. Okay, I want us to stop for a second and think about that. Lack of women in health leadership doesn't just affect women's careers, it dismisses thousands upon thousands of women suffering from real medical conditions that often go undiagnosed to the lack of understanding in the effect of sex differences in pathology and health treatment. And as more recent studies have come to show, these differences are considerable. The most recent studies show that differences exist in our tissues, in our cells, in gene expression, differences that affect the prevalence, course, and reactions to treatment of a lot of common diseases like Alzheimer's, autism, cancer. The list could go on and on. The scary thing is that as women, we don't go to the doctor, get a diagnosis, and think, I wonder if the studies backing this diagnosis or treatment considered sex differences as part of their analysis. But if we did ask ourselves that question, we would realize that most of these studies are made on male rats, then on usually white male subjects, and with so little representation, they are still applied to the rest of us. Women are impacted by this. This means roughly about 50% of the population. And if it's not affecting you directly, it still affects you indirectly through the effect it has on half of the population's driving force. As the pandemic has made clear, thanks to the work of amazing female chief medical officers, having women in power can positively affect everyone. Gender disparity in health leadership is no longer a women's issue. This is a national issue that affects our society as a whole. Okay, so this is clearly an immense issue. How can one even start to tackle this? The bad news is that this will not change tomorrow. The good news is that we can start creating real change in this generation. And the change can start with you right now. How? First, get informed. Become aware of how just big the problem is and how many lives it's actually affecting. I barely scratch the surface here. As a society, we can't address problems we don't know about or don't have enough data about. We need people to spread awareness so that studies can be made, institutions can be made aware, and people can start changing their views on gender dynamics in health leadership. Second, take action. Changing your way of thinking alone won't have an impact. You have to change your actions too. If you identify as a woman, join events or campaigns that empower you to become a more confident leader. Seek and grasp leadership opportunities. And don't forget to look behind you and elevate as many as possible along with you. If you are not a woman or identify as one, still take action. Join campaigns. We also need allies that are able to help us open doors from the inside. Third, empower the next generation of women. If you're in a position of power or privilege, share the spotlight and help elevate women. If you are not, amplify the voices of women and support initiatives that aim to bring empowerment. Following my own advice, this year, for the first time, I decided to take action. I founded Empowering Women in Health, a grassroots organization that seeks to bring awareness about this topic and inspire current female health leaders to join the movement, get empowered, and aim for leadership. The only way we can move forward is by working together as a community, elevating each other towards an equitable future that we all deserve. So earlier I said that gender disparity is a crisis. One definition of crisis is a time when a different or important decision must be made. So if you're watching this, it's time for you to decide. Will you help change the narrative? Thank you.